It's not a happy holiday topic, but each year thousands of kids are diagnosed with cancer. The good news, new research and technologies are helping save the lives of many of these kids. Denver 7's Brian Sanders recently talked to a pediatric oncologist from Rocky Mountain Hospital for Children to see how treatments are improving.
Talk about what types of cancers, how common cancer is in children.
Childhood cancer is globally diagnosed over 400,000 times a year. In the United States, almost 16,000 children will be diagnosed with cancer each year. That's about 1 in 285 children. Most commonly, the diagnosis is leukemia in about 30% of patients, followed by brain tumors and nervous system tumors in about 25% of patients, followed by a type of cancer called lymphomas, and then followed by others.
What is it like treating children who have cancer?
Well, it is an experience that runs the gamut of emotion. Obviously, sometimes it's a very difficult thing to be a part of on a day-to-day basis because there are children who have very serious illnesses. Sometimes there's concerns for survival, and there's a lot of fear both on the part of the patient and also their family. But on the other hand, it's very inspiring because more often than not, we are able to cure the cancer in up to 80%, 80 to 85% in the United States. And for childhood cancer, we're able to cure. Now, that is nothing short of 100% is acceptable. But oftentimes we are able to cure. And so it's such a privilege to be with these families at this moment when they are fighting the most important fight of their lives.
From a research standpoint, from a treatment standpoint, is there anything on the horizon for treatments that gives you promise going forward?
Oh, there's so many examples. And I think that the most important thing is that we are now identifying and diagnosing cancers based on specific proteins that are on their surface and molecular mutations in their DNA. I will share that in the past 2 or 3 years, I have had specific examples of cancers which 10 years ago we probably would not have had a treatment for, in which we had really miraculous results in giving these specific agents, and we just saw the cancer really go away. And in all circumstances that I'm describing, the cancer has stayed away.
Along with our partners at the Colorado Cancer Coalition, the American Cancer Society, the Sarah Cannon Cancer Institute at Health One, and the cancer support community, we've put together some resources for you. If you have questions about pediatric cancers, you can find it on the Your Health Matters page on thedenverchannel.com.